Welcome to the Explainer. Let's just jump right into it. Canine reproduction. It's a fascinating world, right? But honestly, whether you're a professional breeder, a vet student, or just a die-hard dog enthusiast, reproductive failure can be one of the most maddening puzzles you'll ever try to solve. Today, we're going to ditch the guesswork. We're replacing it with a crystal-clear, structured diagnostic framework for exactly what to do when things go off the rails. Think of it kind of like troubleshooting a highly complex biological computer. To really figure out why a dog might be failing to reproduce, we need to map out our diagnostic journey through 5 quick steps: establishing the baseline of fertility, checking for structural roadblocks, identifying functional failures, hunting down infectious agents, and finally, looking at the real danger of pyometra.
All right, starting right off with Section 1, the baseline of canine fertility. Because hey, before we can diagnose a biological problem, we absolutely have to establish what normal actually looks like. Now, you might hear a ton of crazy anecdotes about how notoriously hard it is to breed certain dogs, but under normal, healthy circumstances, canine fertility is actually remarkably high. I mean, we're talking about an 80 to 90% fertilization and implantation success rate. When healthy dogs are mated at exactly the correct time, their biological drive to reproduce is incredibly efficient. So if the success rate is naturally that high, why on earth do we hear about infertility so much?
Well, this quote right here totally hits the nail on the head. It perfectly illustrates the gap between reality and assumption. Often, what a breeder labels as infertility is really just an owner's personal expectation clashing with cold, hard biological facts. A massive commercial facility is obviously going to have vastly different productivity expectations than someone just breeding their individual pet. Before we go hunting for a disease, we always have to ask, is the animal actually infertile, or are they just operating outside of our preferred human timeline?
For instance, age. Age is a massive, completely natural factor that gets overlooked all the time. Peak reproductive efficiency in dogs hits right around 3 years old. After that, we see this gradual decline, which is then followed by a super sharp drop in pregnancy rates once a bitch passes 8 years of age. Older dogs simply have fewer pups born per litter. That's not a disease, you know? It's literally just biology winding down.
Moving right along, let's step into Section 2, structural and anatomical roadblocks. If age and expectations are totally normal, we've got to look at the physical tract itself, the hardware of canine reproduction. So sometimes the hardware is just faulty straight out of the box. Some dogs are born with congenital defects. This can range from completely missing ovaries, which is called ovarian agenesis, to missing uterine horns. And then there are these deeply fascinating, albeit super complex, intersex conditions where a dog's chromosomal sex simply doesn't match its external physical appearance. So a dog might look female on the outside, but genetically have a completely different makeup, making reproduction physically impossible. No way around it.
Now let's talk about acquired physical roadblocks, hardware issues that pop up later in life. On one hand, you could have vaginal hyperplasia. That's an exaggerated estrogen-driven swelling of the tissue that can literally physically block mating. On the other hand, you have something entirely different, a transmissible venereal tumor, or TVT. This is a contagious tumor physically seeded during mating. Both of these are very real, physical, anatomical barriers to success.
Okay, having covered the physical hardware, we transition to Section 3, functional and hormonal failures. If the physical tract looks good, we have to start checking for software glitches, those unseen internal chemical misfires.
Hormones can be incredibly tricky, and there are 2 common software errors that just completely baffle breeders. The first is silent estrus. This is where the internal hormones are cycling perfectly, and the dog is actually ovulating, but it's completely invisible. No external swelling, no discharge. The second is split estrus. Think of this like a false start. The dog shows all the classic signs of being in heat, but then it just stops. No ovulation, only to start up for real a few weeks later. It totally tricks owners into mating the dog at completely the wrong time.
Which brings us to a massive point. Timing is everything.
There is this huge misconception out there that all dogs ovulate exactly on day 10 to 14 of their cycle. While that's the average, perfectly normal, completely healthy ovulation can happen as early as day 5 of the cycle or as staggeringly late as day 30. Just look at the data from tracking 278 pregnancies. It reveals a massive spread in ovulation days. It forms this perfect bell curve, but notice those extreme outliers on the edges? This right here explains why so many supposedly infertile dogs are actually perfectly healthy animals being mated on the completely wrong day. The owner miscalculates the ovulation window, the sperm and egg literally never cross paths, and the dog gets unfairly blamed for a software glitch that was actually just human error.
All right, so if the hardware is intact and the hormonal software is timing out correctly, we've got to move to Section 4, infectious agents. Time to scan the system for malware, how bacteria and viruses are actively sabotaging the reproductive environment.
When we're hunting for malware, we absolutely have to separate the harmless innocent bystanders from the actual real threats. Normal commensal bacteria, like certain strains of E. coli or streptococci, they just naturally hang out in the reproductive tract of healthy dogs without causing any drama. However, specific pathogens like Brucella canis or the canine herpes virus, those are absolute reproductive destroyers. Brucella canis actively causes late-term abortions, spreads like wildfire through kennels venereally, and demands immediate, strict isolation.
And we need to bust a massive, persistent breeder myth right here, right now. Simply finding bacteria in a dog's vagina does not mean your dog is infertile or has an infection. Because of this myth, people just throw random, inappropriate antibiotics at perfectly healthy dogs. Honestly, this practice is incredibly destructive. It wipes out the dog's natural commensal flora, totally destroys their local immunity, and actually paves the way for aggressive superbacteria to just take over. Finally, our diagnostic journey reaches Section 5, the danger of pyometra. This is the absolute critical climax of reproductive failure. It's a life-threatening scenario where hormonal software glitches and bacterial malware violently collide.
Let's look at how this builds into a really dangerous domino effect. First, it starts with repeated hormonal priming from progesterone during the dog's cycle. This hormone makes the lining of the uterus thicken and eventually develop cysts. We call this cystic endometrial hyperplasia, or CEH. This abnormal, thickened, fluid-filled uterine environment, it becomes the perfect breeding ground. Normal bacteria that sneak in during mating suddenly find an all-you-can-eat buffet. They multiply rapidly, turning a simple cyst into a massive, pus-filled infection known as pyometra.
But here's the good news. Thanks to modern veterinary technology, we don't have to sit around and wait for the dog to get deathly ill to spot this. With an ultrasound, we can literally look inside the uterus and spot those dark, fluid-filled cysts of CEH super early on. Identifying the stage early gives us a critical warning window, long before it spirals into a deadly, fully developed pyometra.
If a dog does reach full pyometra, the symptoms are catastrophic and they escalate fast. You'll see severe lethargy, vomiting, and extreme thirst. Why the thirst? Because the bacterial toxins actually start shutting down the kidney's ability to retain water. You might also see a highly specific chocolate brown or yellow discharge. But the absolute worst-case scenario is what's called a closed cervix pyometra. With the cervix closed, the pus has literally nowhere to go. The uterus becomes a toxic balloon that can rupture internally within weeks, leading to fatal peritonitis.
And that brings us to the end of our diagnostic map. By replacing anecdotal guesswork with a structured, clinical approach to fertility, you're now equipped to truly understand what's happening inside the animal. You know to check the physical hardware, to monitor the hormonal software for precise timing, and to be incredibly vigilant about pathogenic malware. So the question I want to leave you with is this. Armed with this deep understanding, how are you going to apply this framework to your own program to protect your dogs and ensure success starting today? Thanks for joining me on this explainer, and keep learning.